Okay. I surveyed the scene. Is it safe for me to approach? I'm approaching my patient. Okay. Hello, good morning. Is this Peter?
Yeah.
Hi Peter, I'm Glenn. I'm one of your staff nurse. I'm here to do some obs, but before that, can I just make sure I do my hand washing? Okay. Palm to palm, palm over torso, vice versa. Fingers interlaced, fingers interlocked. Thumb rotation, palmar rotation, wrist rotation, and allowed to dry for 30 seconds. Hello, Peter. Can I just? Do you want me to close the curtains?
Yeah.
Okay, addressing my patient's privacy. Peter, before I do anything, can I just confirm that I have the right patient? Can you tell me your full name and date of birth, please?
Peter Smith,
Okay, and what is your birthday?
21/9/96.
Okay, verifying with my patient's ID band. Peter Smith, 25/2/1958, with hospital number 726-4201. Okay, I have the right patient with me. Are you allergic to anything, Peter?
No.
No. What name preference do you want me to call you?
Peter.
Okay, Peter, as I've said, I'm Glenn. I'm one of your staff nurse today. How are you? Good morning. I am here to do some sets of observations that includes your neurological function. Will that be okay? Okay, it will take maybe like 12 minutes or something. Are you comfortable?
Yeah.
Are you in pain?
No.
Okay, so if you're happy to proceed, let me just prepare my materials, okay? So, assessor, I'm making sure that my observations machine has been cleaned, calibrated, dated within the service date, and is safe for use. Okay?
Yeah.
So I'm happy to use it. Okay, first, Peter, I'm going to measure your blood pressure. Okay, so we have here your blood pressure. Do you have any arm preference where you can put
Go ahead on your side.
the right arm? Okay, and we have to make sure that this is an appropriate arm to be used. No IV cannulas, no previous surgeries done, no breaks, skin integrity is okay, no pain, swelling, inflammation. Then I'm happy to use it. I'm going to locate the brachial artery by using my hand, and then making sure that the BP cuff size that I'm going to use to my patient is the appropriate size. And how is that? Measured by the BP cuff circumference should cover 70 to 80% of my patient's upper arm. I'm going to place it 2 to 3 centimeters above the antecubital fossa, making sure that the arterial line index marker falls aligned with my brachial artery. Okay, a tight squeeze, Peter. Okay, hitting start. I also need to check my patient's pulse oximeter saturation. Peter, can I have the other limb, your left arm? Do you have any finger preferences?
No.
Okay, I'm just going to use this finger, making sure that skin integrity is okay, no pain, redness, inflammation, no fake nail varnishes. And if it's okay, I'm going to put the probe here after I depress it for 5 seconds. 5, 4, 3, 2, 1. Capillary refill time, if it's less than 2 seconds, I'm happy to use the finger in the probe. Putting it there. Okay, I'm going to check also your temperature, Peter. Do you have any ear preferences?
No.
Okay, I'm going to use a tympanic thermometer and put a disposable ear cover. I'm going to use the right ear. Is that okay? Making sure that it's appropriate place to use. No hearing aid devices, no ear pain, no discharge, no swelling, no irritation. I'm going to put it in, read it, then dispose the disposable cover in the clinical bin. Okay, so Peter, let me just remove all of this contractions from you. I also need to check your pulse rate. Is that okay? I need to check it for 2 minutes. Okay, you have any preference of the arm?
No.
Okay, I'll make use of your right hand. I'm going to use 2 fingers to locate the radial artery. You need to put it across your left shoulder. Okay? Assessor, this timing, I will dedicate 2 minutes to check it, but the first minute would be measuring the pulse rate for rhythm, for rate, and the depth. And the second minute would be for me to count my patient's respirations. I don't want my patient to be aware and conscious about it so that he will not alter the results. If it's done, 2 minutes has passed, I will tell to Peter. Okay, Peter, thank you. Thank you for that. I wanted to tell you that the first minute was for me to count your pulse, and the second minute was for me to count your respirations. And I don't want you to be conscious about it. That's why I didn't tell you. Sorry about that. Okay, so I've done the normal observations. I'm going to proceed with the neurological observations. Is that okay?
Yeah.
Okay. Can you tell me where we are right now?
In the hospital.
Do you know what hospital is this?
Somerset.
Yeah. Okay. Do you know specifically what name?
Something in Somerset. St. Margaret's
Okay,
Hospital.
so
St. Margaret's.
tell me what is your name?
Peter.
Oh, okay, Peter, complete name please.
Peter Smith.
Okay, and then do you know what date it is today?
No.
No, okay. So, oh, I have done that. I will be checking your pupils. I have a torch here. Okay, Peter, the way I check your pupils is that I'm going to shine this torch twice on your right eyes first, making sure that before I do this, I dim the lights to have an adequate environment. So I'm shining the torch. The first shine would be for me to check the pupil size. And then the second shine would be for me to check the accommodation on the other left pupil. Okay, to do it on the next side. Okay, I've done that. Now that I've done that, let me check the motor response for the upper limbs first. Okay, Peter, I'm going to apply pressure on your right hand first. Okay, try to lift it against my pressure. Okay, let's do the other side. Lift it against my pressure. Okay, let's do your feet now. Okay, can you try lifting your leg, right leg under my pressure? Okay, how about the other side? Okay, is that hard? Okay, so I think I've done everything. I've checked the observations. Okay, assessor. Now, Peter, let me just document my vital signs on your chart. Is that okay?
Mm-hmm.
Yeah. So can you provide me with the observations, assessor? Can you just tell me? So
Spontaneous.
spontaneous for eye opening. Yeah.
Confused.
Okay, and then verbal would be confused. Okay, and then motor response for the best one.
Right normal, left weak.
No,
Arm and
best
leg.
motor would be obeys command. Yeah. Okay. Can you tell me the blood pressure, please?
120/80.
120/80.
Temperature 36.8.
Okay, hold on. Almost done. Temperature is 36.8. Okay. Can you tell me the pulse rate?
78.
78. Respiration?
22.
22. Okay, the right pupil size?
3 plus.
3 plus. Left is also the
3
same.
plus.
And then arms for me. Right arm.
Right normal, left weak. Right normal, left weak.
Left will be mild weakness.
Yeah.
Okay. What about the legs? Is it
Same.
the right also the same? Right is normal and then left leg is weak. Okay. Saturation levels, please.
98.
98%. That's good. Okay, so Peter, your GCS is 14 in total, which is actually a good thing. You're a little bit confused, but in your case, because you've had a fall, we want you to be observed so that it doesn't progress into something else that we don't want. So your GCS allows us to formulate a care plan for your sake and your doctor to plan the next step. Okay, you don't have to worry about that. I can see that you have weakness on your left side of the body. I'm going to make sure that your doctor is aware about that. And if you are comfortable in your bed, I make sure that the bed is at the lowest point. Okay, are you comfortable in your bed? Okay, we have to make sure that this bed is always elevated until just 30 degrees so that we don't increase your intracranial pressure. Would that be okay?
Yeah.
Okay, are you still okay? Can we proceed to other assessments? Okay, how are you faring with your mobility as of the minute?
Yeah, I feel a bit difficult now.
Don't you worry, I'll make sure that we have you with your items. You can easily reach them. I'm providing a safe environment for my patient, a clutter-free environment. In case you needed to use the bathroom, just give us a ring. This is your call, Bill. I can always assist you, or some other nurses can do that for you. Okay? How about drinking? How are you faring with drinking?
Not that way now. Okay.
We want you to drink a little bit so that you don't get dehydrated. So I'm putting a glass of water here. If you can drink it with a straw, that would be better. If it's not contraindicated with your doctor, I'll have to make sure.
Is it written there?
No, yeah. So my patient's only allergic to penicillin. What happens when you're taking penicillin?
Rashes?
Vomiting, yeah. You're vomiting, yeah. Okay, anything else that you want me to know, Peter?
No.
Do you feel anything else? What
Can
should
I
I
smoke?
ask? Oh, so this is I know that you are not smoking in your chart. What made you change your decision? You're not a smoker, but in case you want to, the hospital is a free smoking zone. So because we have flammable items here, and we're gonna explode if you do that. I understand that you wanted to smoke. Sorry about that, we cannot do that. In case of the urgency, you feel the urgency, I can make your prescriber prescribe you a nicotine patch if that will be okay for you. Okay, and I can also see here that sometimes you drink alcohol. Is that correct? Yeah, so it's not worrying. Your score is a very low risk according to your admission talk. It's just 5, so that's okay. Are you comfortable as of the moment?
Yeah.
Yeah, I'm making sure that I've done my documentations and then I've written everything in here. Do you know your call bell? So the date today would be here in, assume that is today. I've done my observations and the time would be 1000. Okay, time would be here 1000. I've plotted everything. You know how to use your call bell. And I put you in a comfortable position. I've addressed hydration. You need to drink, okay? And mobility, just make sure that the bed is lower and everything is within reach. And that's it. I think I have everything, Peter. Are you okay?
Yeah.
Yeah, just don't hesitate. I'll be here after 30 minutes, okay? I am happy that I've done my documentation. I'm going to make sure my observations machine is ready for the next use, safely clean. I'm going to end my station. I'm going to do hand hygiene. My tray, everything has been cleaned. I'll address the privacy. Okay, Peter, it's lovely to meet you. Okay. Thank you. That's it.